A dispute arose Monday between the leading food and infrastructure conglomerate BUA Group and the private sector-led Coalition Against COVID-19 over claims by BUA that it had purchased 1 million doses of COVID-19 vaccines for Nigeria. In a statement issued on Monday, the BUA Group had announced that it had secured 1 million doses of the AstraZeneca COVID-19 vaccine through the Afreximbank vaccine program in partnership with CACOVID. The company added that the vaccine doses would be distributed to Nigerians at no cost. However, CACOVID Operations Committee denied that BUA would single-handedly secure the doses, adding that the purchase of the vaccine cannot be done by individuals or companies, but only through the federal government. Joining me live to shed more light on this development is the coordinator of the CACOVID-19 Coalition Against COVID-19, Zouera Youssoufou. Good morning. Thank you so much for joining us. With respect to how the everything comes together, the operation comes together, can you help us explain how the CACOVID Collegiate Fund Contribution Model works?
Okay, so thank you so much for having me this morning. The way this works is we as a group agree on what to actually purchase, how to purchase it, and what the modalities of this purchase would be. So this is how the group has been working since we were created back in March 2020. As you know, we've done several things, including getting testing supplies, setting up isolation centers, PPEs, palliatives, communications, etc. And so the purchase of the vaccines or procurement of the vaccines is very similar to the purchasing of testing supplies, meaning that we do this through vetted, validated, and subsidized means. Right now, there are two mechanisms that three actually, that Nigeria is participating in. One called COVAX, one called the Africa Union Vaccine Acquisition Task Force, which is funded by Afreximbank. And then the third one is the World Bank, also funding some of these vaccines. So Nigeria as a country is a member of all of these organizations. And we, as CACOVID, the private sector coalition against COVID, our role, our job is to support our government in procuring what is needed in order to help our people in the context of this COVID-19. So I think the important things that we all need to know is that there are several steps to procuring vaccines. The first thing is governments are the only ones who can actually buy vaccines. So we, as a private sector group, as individual companies, cannot buy vaccines ourselves. We can't call AstraZeneca or Pfizer or Moderna and order vaccines from them. That's the first thing. The second thing is the distribution of the vaccines and how they're being shared in our country has to be done by the National Primary Healthcare Development Agency, which is the only agency in our country mandated to manage vaccines. And so far, as you know, people get vaccinated every single day. So every day, kids are being vaccinated against everything, BCG, measles, mumps, and rubella, polio. So those vaccines, that whole process is managed by NPHCDA, and they're going to be the ones managing this process too. So it's not a matter of sending money to the central bank. That is one step. But the real step is how do we now get the vaccines into Nigeria and how do we distribute them to the people? I think the most overlooked element in all this discussion, especially when we're talking about getting vaccines next week, is that AstraZeneca or any vaccine has yet to be approved by NAFDAC, which is our regulatory agency. So without the approval of NAFDAC, there's no vaccine that can come into Nigeria and be distributed to Nigerians or shot into the arms of Nigerians. And I think this is where, some of the misinformation had come in.
Thank you so much for that. Very, very illustrative, breaking down the collegiate funding model and how all these steps come into play. So based on that, I do need you to please clear something up here. The statement from BUA said that the central bank governor, Godwin Emefiele, who's the chair of CACOVID, put out a call to arms saying that there was a small window through which to procure these vaccines, and somebody had to step up quickly, and then that's where they jumped in there and then put the funding through. Can you help us out with that?
So first of all, I was on the call with the Afreximbank president, on February 7th with Alhaji Aliko, Herbert Wigwe, and Governor Emefiele. And in that call, President Orama was explaining to us their model and how this vaccine task force was working with the AU and how they've set up a $2 billion facility to help fund the vaccines for for African countries, and that an allocation of 42 million vaccines had been made for Nigeria. He also told us that there was an extra 1 million doses that we could get if we confirmed that we wanted those doses immediately by the next day, February 8th. And so we agreed that, yes, the CACOVID leaders agreed that this was a good thing and that they would bring it to the meeting the very next day, and which happened, right? So when we had the meeting yesterday, that discussion actually happened. What's really important to note is that Afreximbank, after that call, already secured those doses for Nigeria because they had the confirmation from both the central bank governor, Alhaji Aliko Dangote, and Herbert Wigwe, that yes, they will pay for this million doses. Now, the doses don't come in. It's not like we get 1 million doses of vaccine one day getting dumped into Nigeria. They get delivered at a specific pace. So, we might get 100,000 immediately, 150,000 the following week, the next day, another 100,000. So we will never get 1 million doses in one single day coming into Nigeria at once. And in order for that to happen, we have to work very closely with both the National Primary Healthcare Development Agency, which I just explained are the ones who will be managing this process of getting the vaccines into people's arms, but also sorting out the logistics. Vaccines have to be stored at a certain temperature. When they land from the plane, they come out of let me call it a cooler. They have to be transferred to another freezer. Then we have to get those vaccines across the country, right? We also have to follow a very logical, let me call it logistics chain of how we're going to get the vaccines from point A to point B, what centers are going to get them, who are the people who are going to get vaccinated, where are the health workers who are going to be doing this vaccination. This is the work that the National Primary Healthcare Development Agency does. And so Dr. Faisal Schwab has to be part of this conversation in order for us to have any legitimacy in bringing vaccines into Nigeria. So that's the way it happened. But in terms of the vaccines being secured, the vaccines are already secured because President Orama said, sure, no problem, I'll hold these for you. We'll earmark them for Nigeria. Now we need to get AstraZeneca approved in Nigeria, and that's not for us to do, but for NAFDAC to do. And then the payment that will go from CACOVID to Afreximbank on behalf of Nigeria for these vaccines will then happen. So nobody is disputing a transfer into central bank account. Nobody's saying that didn't happen. That's not where the challenge is. The challenge is a claim that one company has brought vaccines into Nigeria, because that's not factual.
All right, thank you so much for that. There's a tweet, I believe, from a spokesperson from BUA Group. I believe in that. So, okay, so there it is. Finds a statement by CACOVID to be, this is your response, your statement that you put out, that CACOVID put out, to be petty, unbecoming, seemingly serious corporate citizens because it's tantamount to playing politics with the lives of Nigerians. I want to focus on the very last part here. It's that this is no time for politics. It does not matter who is helping or paying, as long as we get it out there. Do you still feel it's really necessary, though, to, I guess, clear the air as you've done so that everybody knows exactly how the process works? Or what's your reaction to the tweet?
So first of all, I don't think the clarification is petty. That's one. I completely disagree with that. Second of all, if it's not important to say who paid for who, then why are we being bombarded with people claiming that they did it? I mean, obviously, if we all, let's all live by what we say. So if it's not important to say who did what, then let's not. But at the same time, I think it's really important that we clarify the process. The idea that people would be expecting 1 million doses of AstraZeneca vaccine next week in Nigeria is not correct. It's not possible for us to even say that because, like I said earlier, we do not have an approval from NAFDAC for the AstraZeneca vaccine. And you can, check this with Dr. Mojisola. I'm sure that she'll be happy to tell you that she hasn't approved AstraZeneca. We're also hearing all kinds of, stories in the news about the validity even of the AstraZeneca vaccine. And what's really good about these mechanisms that I was describing earlier, the COVAX, which is the one run by WHO and Gavi, and the African Union one, what's good about those is that they give us a platform to have subsidized, affordable, free. Everything that we do at CACOVID is free anyway. Like, nobody's playing politics with anything. The vaccines are going to be free anyway. Everything that CACOVID has done so far has been free to Nigerians, and that will continue to be the case. But the idea that we would have 1 million vaccines next week is not realistic, because you will talk to the National Primary Healthcare Development Agency and they will tell you they have no idea what you're talking about. You'll talk to the head of NAFDAC, and she also will confirm that who is receptioning these vaccines. So I think it's important that we, walk people through the process. A lot of things have to happen in order for the vaccines to come here. The logistics, the plan, who's going to get them first, who's going to get the vaccines, who are the health workers given the shots? Do they need to be trained, retrained? The needles are very different for this particular COVID vaccine versus the other vaccines, et cetera, et cetera. So there are many questions that are beyond sending a payment to central bank. And I think that's the part that really needs to be clarified, because it's not about being petty. It's about, let's get the real information out here for people to know.
All right, fantastic. Well, I want to thank you very much for being very illustrative and explaining how all this works. But I want to try to end this on a positive note. CACOVID-19 has been very important and played a very important role in, as you've mentioned, ICU centers, supplies, PPE, palliatives, and so on. The BUA Group is a member. They've also contributed to this. Is there any way this ends on a note of camaraderie, so you can continue, because we're still in the second wave right now? There's still a whole lot that needs to be done. In a minute, if you can this be smoothed over over the coming days?
Yes, I don't know what dispute we're having. We're simply saying, let's clear the air. The idea of the collegiality of this group is we have many different members in CACOVID. We have people who contributed 2 billion naira. We have people who contributed 50,000 naira, and everybody's voice is just as valid. And there's no reason for us not to get along or to have a dispute with a CACOVID member. That's not what we're trying to do, but it is very important that the Nigerian people understand that this is actually how this will happen. This is the process. And the process is a lot more involved than there's no issue.
We just want to we're going to keep you on. We're going to take a quick break. We'll be right back to continue this conversation. Please stay tuned. All right. Welcome back to the Global Business Report on the Rise News. We still have, of course, our special guest, Zouera Youssoufou, who is the spokesperson for CACOVID-19, the Coalition Against COVID-19. Of course, talking about this clearing the air with about this dispute over vaccines with the BUA Group. Before we went to the break, Zouera, you did say things would be smoothed over. I just wanted to clear the air. I do want to ask you one more question, though, before I let you go. Who's picking up the tab for this delivery of the vaccines when of course, they do arrive? Can you clear that up for us?
Yes, CACOVID is paying the tab. We have an account at Central Bank where everybody contributes their money. So everybody, all the various CACOVID members, the CACOVID leaders, so the steering committee, the ones who meet every week, are the ones who have put in the most money. And the account at CBN has everybody's contribution inside, and that's the money that Central Bank will now transfer to whoever when we're making purchases. So if you remember all the things that we bought before, you never heard an individual company saying that I bought this, I bought that, because this goes in a general pool. So who is actually going to be paying for the vaccines that go to, for the money that's going to Afreximbank this week? Will be a hodgepodge. It's a mix of the money that's commingled in the CBN account. It's not any one particular CACOVID donor that's contributing the money.
All right. Thank you so much for your time. Spokesperson for CACOVID-19, of course, Zouera Youssoufou. We appreciate you clearing the air and coming on in to help us out with that.
You're very welcome. Thank you.